Hey, this is Jason the PT, and today I'm talking about headaches. What people don't realize is physical therapy can help you with that, especially the ones that kind of start here and get progressively worse throughout the day and start to refer forward into the head. A lot of people tell me, I'm at the desk, I'm banging away at the keyboard, and I'm starting to get these headaches. They don't know what to do about them. They try pills, they try this, they try that. Effectively, what you're dealing with is almost like sciatica of the head. If you've been sitting for prolonged periods of time, you're starting to compress these joints in the upper part of the neck. When they start to get irritable, what it does is irritate those nerves that then wrap around and start to give you that kind of referred pain out into the head. So yeah, let's take a look at what's causing that and how we're going to go about fixing it.
Okay, let's take a look at those cervicogenic headaches. How they typically present, patients will tell me about pain that starts kind of at the back of the skull and then gradually starts to refer forward and end up kind of behind the eye and occasionally travel down the neck a little bit. Now, I like to think of these headaches as kind of like sciatica of the head. The joints in the upper cervical spine here get jammed up. They irritate those nerves, which then cause basically sciatica of the head. They start to project symptoms out into the skull, behind that eye, or even down the neck. Okay. There are other different types of headaches. The next most amenable treatment can be migraines. Okay. There may not necessarily be any sort of problems in the neck, but they will present mostly with symptoms here. Okay, if there's any sort of weakness here, you can get some referral into the face, and the patients will tell me this is where they're feeling their symptoms. They'll typically have some prodromal auras or something like that, where they're seeing like lights kind of around objects, and there's usually some photosensitivity. One other very common type of headache that I'll see, which may not be amenable to treatment, is if they're getting crown pain kind of through here. Okay, now that can be because of stress. These are called tension headaches, but it could also be because of blood pressure. So if there's any sort of throbbing that kind of comes up and down while you're having this type of headache, you definitely want to check your blood pressure to make sure it's not elevated, because that's what could be causing these symptoms. But let's take a look at the anatomy for those cervicogenic type of headaches. Okay, let's take a look and see what's causing those cervicogenic headaches. So what we're going to do is we're going to go ahead and just peel back the skin. And what we're left with is the skeleton, the joints of the neck, as well as the nerves that exit from the neck out into the face. Now, there's two joints that are usually the most responsible for them. One is the OA, or the atlanto-occipital joint. And what that is a joint that's right here in the back of the neck, right about there. That joint is responsible for kind of retraction, like when you tuck your chin in. And that joint, when it gets stuck, you can see it's quite close to a lot of these nerves. So if it gets stuck and irritable, it will irritate these nerves and send pain up the back of the neck. And in some cases, because it's close to the front, it then comes out behind the eye. Okay, so there's that joint that causes problems. And then you can kind of come down, and then just below that joint is the AA joint, or the atlanto-axis joint. And that does rotation. So you're 45 degrees of rotation in both directions. So when that joint gets stuck, or the one that's immediately above it, that will then start to create irritability, and it starts to irritate those nerves, and it will send symptoms out into the head, almost like sciatica.
So let's take a look at these joints on the model. What we have here, this would be the back of the skull. This would be C1, the very top vertebrae in your neck, and then this would be C2, okay? So what happens with problems at the OA joint right here is that it actually can't retract back and forth, okay? So when this joint gets stuck, and very often it gets stuck in its forward position this way, because people sit and they slouch, that joint gets stuck in that position and then can't retract and come back this way. So then that will start to irritate those joints and then send symptoms through the back of the head. The other joint that creates problems is this one right here, the AA joint. Now this joint, what its job is to do is allow the head to actually rotate back and forth. So this joint right there, when that gets stuck, that can also then project symptoms out into the head. Okay, let's take a look at how we can use manual therapy to relieve some of those headaches. So this would be the back of the skull here. This would be the very top vertebrae, C1, and then right below it is C2. Okay, so this joint would be the OA joint, and then this joint right here would be the AA joint. Okay, so in motion, this AA joint does retraction and protraction, so it slides kind of back and forth just like that. Okay. Now, when patients are in front of a computer for long periods of time, they have a tendency to kind of slink forward a little bit, and that will cause this joint to get stuck in its forward position, and then it can't come back. That compression at that joint will then irritate all of those nerves I had showed you before, and then create some of those headaches that do get progressive. So to address that joint, all you do is you have the patient kind of on their back. I would cradle the head just like this. You also stabilize the head in the front, under the chin, but basically you create a traction technique. All you're doing is giving a traction force up to unimpinge that joint to then allow it to kind of glide back and forth, just like that. To get at the AA joint, which mostly does your rotation, it kind of goes back and forth just like this. If a patient has been looking at a monitor to one side for too long, that joint can get stuck in its rotated position and then can't move forward, which will create compression. So let's say the patient's been looking at the monitor to the right for too long, that joint gets stuck. You can do a technique where you stabilize the vertebrae below it, and you basically give it a push in that direction to relieve that and restore that motion. But those two joints, when they get impinged, they're going to start to light off the nerves and give you those pain into the head from there. Okay, so we've seen the different types of headaches. We figured out which joints in the cervicogenic type cause problems and how they refer symptoms out into the head. We've seen how manual therapy can then restore some of that joint mechanics to allow them to move. Now we need to rehabilitate those muscles. So here's a couple exercises I give to patients on their initial evaluation to help strengthen those muscles. First, what you do is you take your hand, and we'll assume that the problem is here on my right. You can take your hand, you put your fingers right above the eye, kind of at the temple here. And then what you want to do is strengthen these muscles. So what I tell patients to do is turn to that side, but with the hand, resist. Give some resistance to that turn. And then once you get to about 45 degrees, the hand is going to push back, but the head slows down. So you're pushing through resistance and then controlling back. And I'll typically have them do that for 2 sets of 10, something like that. Okay. The other thing you can do to get the retraction a little bit more specifically is you take your hand, but this time you put it on the back of the head. Okay. And sitting up nice and tall, you're going to do that same thing, and you're going to turn to your left because the head is going to come to that side. So when you turn this way, the back of the head goes this way. Take that hand, put it at the back of the skull, sitting up nice and tall, and it's the same thing. You're rotating, but that hand is giving resistance. And then as you come back, the hand is winning, but then the head is slowing it down. So 2 sets of 10, just like that. Turning this way, resisting at the back of the head, and then controlling back. If you're doing it right, you're going to feel it kind of up and through here. So I give people that exercise as well as your basic chin tucks with a little bit of rotational bias. So again, if I'm having problems here, I'm going to rotate to that side, and then I'm going to do my chin tucks. And it's not just a straight retraction. It's actually a retraction and a dip, okay? Because it's going to take that back joint and move it this way to help mobilize it. Because everybody gets stuck here. You want to bring your chin in and then bring it down. And that rotation is going to bias that joint a little bit. To get some of the lower cervical muscles, because they're often involved as well, what I typically do is have patients kind of lean forward a little bit, just like this, shoulder blades back, and then drop the chin down to the chest, and then basically holding a chin tuck, and then bringing the neck up back to a neutral position. Just like that. And if you're doing it right, you're going to get these muscles back here. But that's typically how I start patients out with their headaches. And then I continue with the manual therapy and all of the stabilization stuff up here, as well as some thoracic stuff. So hope you learned something. Follow me for more.